that those counties should say, hey, we have enough activity in our county that our sick kids really need to be evaluated. Remember last week we went over that in our flow chart, and I can go over that again. I have that slideshow pulled up because I know a lot of people missed that last week. It is on their websites though, if you need to go back and look at it. But if you have students with symptoms, the next box is, have they been exposed to someone with COVID, or are you in a region with risks level 1 through 3? Well, now it's risk level B, C, and D. This risk level E is a newer one that wasn't originally there. So scrolling down, you can see our levels here. I wasn't able to color these all the way across just because of issues, but the highest risk level ones here, I did look into the data more deeply. So Isabella is in the very high risk category, but I looked back at the last 2 weeks worth of data. If I took out the CMU cases, they're averaging 4 cases a day, and the daily cases per million are 57. So it's about half of what they are with the CMU cases. So again, we still do not feel that you need to make any changes to your in-person education unless you have ongoing transmission in your school or some other factor at play. In Osceola, they've been averaging about a case a day. And looking back over the last 2 weeks, there really is no specific pattern. There's no unusual outbreaks or anything. So they've just had some higher case counts, but again, it's not anything massive. It's just about a case a day in that county. So District Health Department number 10 in Mecosta County, again, they're very high. However, over the last 2 weeks, about 70% of the cases are related to Ferris. And if I take out the Ferris cases, they're averaging about 1.5 cases a day. And the daily cases per million are 36, which is in the medium high category. So again, we do not feel, unless you are having some ongoing transmission in the schools or other issues, that you need to adjust how you are educating. Oceana County is in the high category, but over the last 2 weeks, 92%, so nearly all of their cases have been associated with 2 separate agricultural outbreaks. And all of those age groups have been older than the K through 12. Some of those might have K through 12 students in their household. So again, at this point, we don't recommend you change your school setting unless you have ongoing transmission. But just know, of course, there could be some exposures, so just be aware of that. But really, they are all isolated, essentially. All but one really has been associated with those farm outbreaks. In Mid-Michigan District Health Department, Clinton, about a quarter of the cases over the last 2 weeks have been school associated. 4% of all the cases have been K through 12. 18% of all of them have been college outbreak related. Over the last 2 weeks in Gratiot, over half of them have been associated with outbreaks. Most of them have been educational. 25% of them have been related to K through 12 outbreaks. 29% have been related to college outbreaks, primarily Alma College. So if I took out the school outbreaks from Gratiot, they are averaging about 1.5 cases per day and about 40 cases per million per day. Montcalm, there's really not been any major pattern over the last 2 weeks. There has been one small school outbreak, but otherwise there has not been any other major patterns. So again, we'll send this out to you and we'll continue to do the data like this and just keep adding it on so you have previous weeks right at your hands there. So again, I just made a slide here that has those counties listed. Of course, you need to take other considerations for risks of contact to COVID in mind when you're considering getting students evaluated. And also at your discretion, if you have concerns about any student with symptoms, you can always say that they need to get evaluated. So just some before I move on, just some things that have come up or just concerns or questions, other topics. One of them is when you have any visitors or contractors coming into your building, make sure you're having them sign in so you know what days they have been in. Just a reminder, in the Executive Order 142, which covers all school activity, it is required that you only allow in employees and contractors that are necessary to conduct school operations. So you shouldn't be having any extra visitors in, but those that you do have in, you want to keep note of. The Executive Order to Safeguard Michigan Workers requires that all workplaces, if there is a case, that the employer notifies any coworkers, contractors, or suppliers that may have come into contact with the person with COVID. There is no subgroup for schools. There's ones for contractors, for manufacturing. The one for offices is kind of the closest, and it requires that the employer notifies all employees, including customers, suppliers, or visitors, if there's been a confirmed case that's visited the office. So again, if you do have a case, just remember to go back and check that sign-in list and see if you've had like a hearing and vision tech or occupational therapy or any other kind of contractor or visitor that might have come in and had contact with that student. And if you're not sure, you can always just notify them and let them know that there was, you know, when you're sending out that letter to notify people that there was a case, you can just contact those individuals and let them know. So we just want to make sure that those people that are not there every day are remembered. This was something that was mailed to us. I just want to make sure you were aware of it. MDARD sent out a press release just reminding schools and businesses to use EPA-approved disinfectants. We have talked about this before, so there is a list on the EPA website to help you to figure out which products those are. So I just wanted to share that. I assume you probably all got it, but I just wanted to share that. We're getting questions and concerns about activities. You know, right now we're getting towards homecoming and school dances. So the Educational Executive Order 142 prohibits all indoor assemblies that bring students together from more than one classroom. The Safe Start Executive Order 176 regarding organized events. There's an FAQ, a social gathering or organized event is anything that brings people together, basically. It doesn't apply to school functions other than things that occur like assemblies. So it doesn't apply to education or summer camps, but it would apply to things like school dances or assemblies. So with regard to gatherings, events, or large venues, other than Region 6 and 8, which I'll talk about in the next slide, you have to be able to maintain 6 feet of social distancing. And if it's indoor, it cannot exceed 10 people. And if it's outdoors, it cannot exceed 100 people. So if you're considering having any kind of activity such as this, those are the requirements. For those of our counties, those few counties we have that are in Region 6 and 8, the requirements are that the venue must be at 25% of its maximum capacity or limited to 250 people, whichever is smaller. And then if it's outdoors, it's 25% or 500, whichever is smaller. So. And then we've had questions about Halloween. CDC does have some guidance on their website about Halloween and Thanksgiving and just other general holiday considerations. Moderate risk is considered kind of grab and go trick-or-treating. So if you were to leave treats at the end of your driveway and kids can just walk by and grab things. If you have outdoor costume parades that are small and everyone's spaced apart, and if you have outdoor haunted forests that are just one-way traffic, but higher risk would be traditional trick-or-treating, trunk-or-treating, indoor costume parties that are crowded, and indoor crowded haunted houses, or hay rides or tractor rides with non-family members. The state is drafting up some further guidance on Halloween, and we hope to see that soon. We've also had some calls about other illnesses. We're getting into flu season, and then we'll have norovirus and all the other normal fun illnesses we see every year. So I just refer you back to the Managing Communicable Diseases in School. I was reviewing it again today. It really has a lot of good information, just general information that applies to both COVID and anything else really. So for those of you in your school that manage all of this fun stuff, like what to do when you have a sick kid, how to prepare for it, how to report things, just everything. It really is a very useful thing for them to review. So I'd really have you encourage them to do that. But from that report, these are copy and paste from that. So any outbreaks or suspected outbreaks that you have, you should be reporting that to the health department, and we can help you decide if you are having an outbreak. And not all outbreaks will necessitate you need to close, but sometimes you do need to, just to help disinfect or to stop the cycle. We usually do see this during flu season, and whenever you have questions, you can consult with us and we'll help you. How long you need to close for is kind of based on what the illness is, because they all have their own incubation periods and their own needs. The decision to close is really, we try to help you make a decision, but it really is up to you. If there's ever a situation where it's a public health threat and we have to get involved, we will, but typically it is left up to the school system to make that decision. I was just asked to pass this on. This is not COVID related, but the governor's office had a meeting the other day and just asked that we remind schools about proper flushing of the water systems. And this is just a lead prevention and water contaminant prevention technique. And so I just provided some links to that to help you with that. So it's just, while we have your ear, we wanted to pass that along. And then before we get to questions and answers, and we can talk about this more once we have question and answer. We know that for those of you who are having issues or questions, we do talk with you. You call us, you email us, and we have good communication. I think the new information that's coming up that we need to bring to you weekly is getting less. And so we were wondering if there was a desire of this group to start meeting every other week, with, of course, you having the ability to contact us when you need to with questions, or if there's still a feeling that having these weekly meetings is useful. So we'll just put that up for discussion, and I will then open it up for discussions. I'm going to continue to share my screen if it works out, just because then I can pull up my other slides if I need to from previous weeks. So I will turn it over to Janine if she wants to field questions for me.
Yep, I can do that. Okay, so the first question, and Dr. Morse, I can hear myself if you want to mute yourself.
Oh, I'm sorry.
That's all right. So discrepancy for Osceola data that I am looking at on the MyStart map, it shows us in A, not C. So Osceola data on the MyStart map shows that they are an A, not a C.
See, and now I'm here talking to myself, Janine.
Sorry, I had a feeling.
That's okay. I was saying that it could be that between yesterday and today it has changed. that happened last week where it changed in the morning on Thursday, and at 12:30 I was scrambling to get things done. So, yep. So when I pulled it yesterday, I pulled it yesterday morning, afternoon, and that's what it was. So within a day, it has changed. And I just, again, after last week trying to change all of that within 15 minutes, I just decided I can't do that. And so I did this graph yesterday, and we have to defer to you guys to keep up to date on your own county data. We'd rather play it safe than sorry. And so if you over refer students for evaluation when they have symptoms, to me, that's way better than under referring students for evaluation. But again, as of yesterday, that's what these numbers, so I have that right up here. I pulled the info on the 23rd. It said it was as of the 22nd. Some of these say different dates, but the private portal of this said it was as of the 22nd. But anyway, so yeah. So as of yesterday, that's what Osceola was. So I will have to defer to you guys to keep more up to date with your information on this website.
Okay, and I added a note that if anybody that is in the District Health Department number 10 jurisdiction is not receiving emails from us, you can send your email to me. I listed my email there, and we'll make sure you get added to the list. Dr. Morse, I had a few questions come through about some of the information you said that you would email to everybody. And I'm not sure if the nurse, it's different in each of our 3 health department jurisdictions how emails are managed. Some come directly from the nurses and some come from the public information officer. So yeah, I just wanted to let those know that we'll make sure you get added to the DHD 10 list if you're in our jurisdiction. Okay, so the next question, Dave Cox. It looks like everything is white, so I cannot see. If you look at the chat box, I don't know if it's just me, but everything is in a white bar.
The one from 117.
Yeah, 117 and then
yeah, I can read it.
Oh,
it says, Dr. Morse, are you still not recommending a quarantine for out-of-state travel at this time, even if travel is hotspots? The last I checked, there is no official recommendation for that. So that is, the CDC alludes that you can do that if you want to. So that is to the discretion of the school.
Okay, so S. Locke says, I think every other week would suffice. And then Bob Grover says, can we get the data sent to us via email weekly?
Yep, I can update that every week still.
And so Dr. Morse, the things that you're emailing, is that also posted on the website, or is it different?
So after this talk, I send the PowerPoint, the data table, and any other things I have to my 3 health departments and ask them to email it to our mailing list for the schools and to post it to the websites. I never follow up to make sure it was done, but that's what I asked to happen. And from what I have noticed on our websites, it appears that it does happen. So all of this stuff should be on our websites and should be mailed out as well. I know sometimes it takes a few days just because of how busy everybody is. So I know.
Hey, Dr. Morse, this is Bob Grover, and we do get it weekly, but if we switch to a bi-weekly, that's why I was asking if we could still get it sent.
Yeah, I think what Janine is probably asking is if we put it on our website, is that good enough? And I'm just thinking, I know for some people, you kind of forget about it being on the website or how to get to it. And I know it sometimes takes, I know there's sometimes delays for us to get things up on the website just because we're all busy. So I'll have to talk, you know, I don't want to speak for anybody on my team and promise something that we can't do. So my thought is if we still email it out every week, I don't have a problem with that. So.
Yeah, and my concern was that there were, on our email list, several emails bounced back. So things didn't get delivered. And then we've also added a lot of people to this call that may not have gotten added to our email list. So I would get a lot of requests for people to add to the call that may not be in my jurisdiction. And so, yeah, I just want to make sure that everybody, you know, that all the information is on the website. If you aren't getting it via email, it is on the website. That was my main concern. Okay, so Dave Cox, are you recommending a staff member who does not have symptoms, but a household member does, to quarantine or not? If not, some staff work with medically fragile students. Should they quarantine?
So if you have a person, staff or student, who has been a close contact to a confirmed or probable case, they should be in quarantine. If you have someone who's been exposed to somebody who has symptoms, but they have not been confirmed as a case, or they are not a probable case, and a probable case is someone who has symptoms and they themselves have been a close contact to a confirmed case, we do not typically put them into quarantine. So we typically wait until we know for sure that they have been a close contact to a real case. If you have staff that are working with fragile students and you want to put them on quarantine, if they're by anyone who has symptoms, you can choose to do that. The issue is oftentimes you'll be quarantining people who do not need to be quarantined and you'll run out of staff. But again, the guidance we have and that we give is that you quarantine people that have been close contacts to a confirmed or probable case, not just someone with symptoms.
Okay, next question. Bay County is recommending keeping classroom doors open during the school day. We've been advised for school safety to keep closed and locked. What is your recommendation?
So if you can increase fresh air ventilation, that is helpful. You need to follow, though, your safety rules as well. So opening the doors, unless you have fresh air ventilation going, is not going to be a major help. So again, if you can open the doors and then have a fan blowing fresh air from a window, that may be a benefit, but you shouldn't do it at the detriment of safety protocols. Ventilation and air exchange and those things are probably the lowest priority preventative measures after masks and distancing and hand washing and all those other things. So again, if you need to keep doors locked and closed, then that should be a priority. The one issue with that, though, is then people need to touch the doorknobs more often. So you need to really then focus on door cleaning. So.
Okay, so it looks like Clinton data on the map and spreadsheet does not match either. So again, like Dr. Moore said, go and check daily, probably regularly, to see if it changes.
And again, we're looking at trends, not just day to day. So, but again, 67 and 38. Yep. So again, I mean, it just, this was, 12 or 24 hours apart. So I can't change it that quickly on the spreadsheet. So.
Okay, next question. For the district point of contact, is there a time of day that we should try to check the spreadsheet documents that we have linked with the health department?
So this is Jackie from Central Michigan District Health Department. I'll answer that question because we are creating SharePoint drops for a point of contact at each school or district that they can check it to see who is which of their staff and students need to be quarantined and should not be on the premises. So we are working on that right now. Like this week, we're currently working on it. So we will send out instructions, and the best time to check that when we have more of the process kind of figured out. But it's on its way.
Okay, and that was for Central Michigan District Health Department. I don't know if we have the same procedure at District Health Department number 10. Jackie, I can connect with you and kind of get a feel for what you guys are doing.
Yeah, of course.
I believe for the other health departments, they have a PDF form that they fill out. It's the same form, I believe, but they just send it to the school directly.
All right, thank you, Dr. Morris. Next question, what is the latest on wearing masks in PE when inside? I know it was referenced last week, but it sounded like it was going to be looked into for past direction.
And I didn't look into it. I didn't go back and look at the roadmap. My assumption, given the guidance now for sports and other things, would be that masks must be used for inside PE, as that would be consistent with sports.
Okay, next question. Kent County Health Department put out some helpful flow charts. Have you had a chance to review them and see if their recommendations align?
Yes, I have reviewed them. I have them, and no, they don't align. They're more like the Oregon flow charts. They do not take into consideration whether they've had exposure to COVID or the county prevalence of COVID. So basically, if they have symptoms of COVID, they need to be evaluated or tested prior to return to school. So that certainly is a way to go. And I can probably pull them up right now. Here we go. Well, actually, that's definitely a way to go. And I was looking at potentially editing them for our use. Yep, here it is. So student screens positive for symptoms or develops symptoms at school and has no known exposure. So healthcare evaluation is indicated. So there's no, it's basically any kiddo with any symptoms. If they get an alternate diagnosis, they can return to school. If there's no clear alternate diagnosis, then they have to have COVID testing. And if it's negative, they can come back to school. If it's positive, so on and so forth. If testing is not done, they need to isolate at home, and you have to make their siblings quarantine at home. So it's extremely conservative. So again, it's similar to Oregon, but this part at least is even more conservative. So.
So will there be a new flow chart with the risk levels A through E? Dr. Morris, I don't know if you're muted.
Yep. Yes, I am. One of the boxes, this one here, it should say test result negative, or I added a little footnote here because I shared this slide with somebody, or received an alternate diagnosis. I had just this one comment here, so I need to add that in there to make it as clear as can be. So I can work on that. I can't make promises how quickly I'll get these things done, though. It's been pretty busy.
Okay, Mid-Michigan and other departments, Dr. Morse oversees.
So that was
As
a
far as-
continuation from my earlier question. You can disregard that.
Oh, okay. Okay, so next question. This is Jamie Banstra, Superintendent at Gateway to Success Academy. I was recently added to the call list and want to make sure I'm on the list to receive your emails. What county is that in? Jamie?
I'm Mason County.
Okay.
Yeah, sorry, I would have added that privately. I just didn't see a way to do that, so I just threw it in the chat. Sorry about that.
No problem.
All right, thank you.
We'll make sure to get you added, yep. So Dave Cox, Dr. Morse, are you still recommending that a staff member that had symptoms, even with a negative COVID test result, quarantine for 10 days?
So as we went over last week, that is what the CDC recommends. That's still what our recommendations are, consistent with that. Again, if the schools wish to do differently, or have considerations where staff have unique situations and they're not as concerned about it, that is up to their discretion.
Okay, so it looks like the advice you gave about indoor gym was yes, they needed to wear a mask.
Thank you.
Okay, next question. What about the use of masks by a middle school gym class that is outdoors playing tennis? The MHSAA does not require masks for tennis competition, which is outside, but because this is instructional, we have been requiring the use of masks. What is your guidance on this?
You guys are stumping me today. So if you're outside and you can maintain 6 feet of distancing, my opinion would be you don't have to wear facial covering. I think at this point, if you follow what the state recommendations are for sports and masking, which you can find in the executive order and in the FAQs for the executive order, you should be safe from an order standpoint. I know the MHSAA hasn't interpreted all of those perfectly, in my opinion. So I think it's good to go to the source once in a while for a double check.
And Ryan added, I'm going off the previous question and I apologize because I had to take a call. What would be the recommendation of elementary gymnasiums used for PE if we are not requiring elementary students to wear masks? They can be distanced.
So if you have K through 5 schools and the class is never mixing or interacting with any other class at any time, so they do not have recess, they don't have lunch, they don't have anything else with any other class, then they can take their masks off. Per the rules, it's still best if they wear their masks as much as possible.
Dr. Morse, this is Marcus Cheatham, Health Officer, and I'd like to weigh in with a health officer perspective on this. I feel like some of the questions are trying to find opportunities to not do things that are protective. And I just want to remind everybody else, many of our districts are experiencing outbreaks. We've had some that have had to roll back to virtual only, some that have had to shut down all sports. So the consequences of being too loosey-goosey are very serious for you. So I would just encourage people to, if you don't know whether masking is required or not, lean mask, because many of you are going to find yourselves, having to do things you don't want to do right now, like be virtual or close sports, if you keep creating opportunities for the virus to spread.
Thank you, Marcus. We've seen that happening. So yeah, the default option should be mask always, even and especially in our younger kids. Again, the rules say you can go without them, but that's the rules. The recommendations really are mask, 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 mask. So I know it's not fun and I know nobody likes it, but we are in the 19 counties I cover. There's been a lot of outbreaks and a lot of struggle, and we want to keep kids going to school. So not all of them have been big, but we've definitely seen some repercussions of more liberal use of, or less, I'm not sure the right wording, like Marcus said, more loosey-goosey use of masks. So again, I know it's frustrating, but when in doubt, use the mask.
So there's no more questions on the chat. If anybody has any additional questions, feel free to either unmute yourself and ask directly, or share anything that has occurred in your schools if you'd like to, or feel free to put it in the chat box.
Yeah. Dr. Morris, my name is Jennifer Verliger. I'm interested in if you could just once again review the changes in the risk, official risk levels in the map. I just want to make sure that I'm clear. When I look at this now, I see levels C, D, and E that correlate to the earlier 1, 2, 3. And if that is correct, when we look at test results and new cases, if we are C, D, or E in any of those areas, then are we considered high risk? I'm from Mount Pleasant Public Schools, so Isabella County.
Yeah, it's kind of confusing how they did this. It's actually B, C, D, and E. This E level didn't used to be on there. It used to be, this D used to be 1, then 2, 3, 4, 5. This level E was one that they added on there. Let me pull up the table. So this first one they just call low, and then they go to A, B, C, D, and E. So, oh, I don't look at this one. I didn't fix that one. See, now I'm confusing you more. So B, C, D, and E are the groups that we would say are the ones where you need to get people evaluated just because your community incidence is higher. In the matrix, this has more to do with school closings and things. They really look more, even in level B, if you have ongoing transmission, you start to take action. But it's not until you get up to the D's and E's where you might have to actually go to remote learning. Again, this is just a guide because we've had schools that are in these lower categories, but they have, well, I guess that really goes down into here where we've had to take pauses to help that outbreak to stop. And you may have really low community incidence. And if you have an outbreak, again, it says in here to take a pause. I'm trying to see if I can find. Yeah, see, it was this, I'm trying to find where I have it from before. I know some of these I goofed up on, but it's these four. This highest one was not on the previous My Start map. It was just added into the matrix. And now when they've revamped this map, they added this in. I don't know if they've put it into the explanation or not. And I realize I'm looking at the private version of this. Let me see if the public facing one might look different. I'm trying to see if it gives an explanation or not. But anyway, I know that that's not the biggest help in the world, but.
So I guess my follow-up question then,
Yeah.
with the recent flow chart and the letter that you sent out, schools in Gratiot and Isabella counties are just working on getting those letters out to families today and tomorrow. So really on that flow chart, we just need to change that one box from 1 to 3 to say B, C, D, E, and those 4 categories would then put us into high risk. But our counties are still considered high risk at this point because they're a high risk in one category. We're a C in cases per million.
Yeah, we go with the highest number, and really none of the counties have really ever gone very high in percent positivity, but you do default to your highest number. So the fact that the daily cases per million are in the very high, and I know that Lisa had talked to me about that letter for Gratiot County, and I forget about Gratiot, Isabella, RESD. What I had talked to them about is not necessarily saying if it's high or very high, just saying substantial or significant, because when you throw in words like high or very high, the lay public might not quite understand what that means, or might find it more alarming than it might need to be. But to say, we have significant or substantial community spread. But if you need, because when I did that, when I shared that letter with Lisa the other day, that was before we had this update, and now it's all different.
Okay.
But
okay,
you're correct. It would say
okay, thank you for your help.
Yep.
Okay, we got another question, Dr. Morris. It says the upper left corner of the matrix states with mitigation measures, and all of the rest in the green state strict mitigation measures. Can you explain the difference? And you're on mute if you're talking.
I'm not yet. I'm thinking, because
Oh.
It seems like, down here, if it says anything about strict, I honestly think they probably forgot the word strict here. And as many times as this has been edited and reviewed, that's a bit surprising, but I honestly think they forgot the word strict. But this is what they mean by mitigation measures, is right down here. And it's essentially doing everything that you're supposed to be doing per the roadmap and what we've been discussing on these calls. So
they're saying it is there at the bottom in the second sentence.
So under, I see number 1, number 2.
After mitigation measures. Okay.
Okay.
So it's in your, yeah, that one.
Strict include, oh, okay. Thank you. So doing everything that's recommended, not just required. So, okay. Which in my opinion, you should be doing anyways, but that's just my opinion, so. Okay. Thank you, whoever has better eyeballs than I do.
Okay, so any other questions? Any other discussion? Did anybody have anything they'd like to share on how they've handled situations at your school?
So before we lose any other callers, my thinking then, unless anyone objects, is we will not have a call next week. And then we will go every other week starting, I think it would be the second Thursday in October. Unless anyone has objections, and I'll still work to get data out each week. But again, continue to follow it on my start map. And if you see any oddities and you want some analysis as to why your numbers are the way they are, let us know. If you have questions, let us know. And the link, I believe, Janine, it'll probably be the same link as this, but we will send out a new meeting invite with the new information, but it'll likely be the same link as this. Would that be correct?
Yeah, I think what I'll do is go in and cancel the every other week starting next week. I'll just cancel those and keep the ones that we're gonna have the meeting dates. So I should be able to just adjust it, but it would be the same login.
But we'll send out a new invite or some type of something to let everybody know who couldn't make the call today that we've adjusted the schedule, but we'll try to keep the same link so that that doesn't add to the confusion. So, all right. Well, I don't have anything else. So unless anyone has anything, everybody have a good Thursday, Friday, and good weekend.
Thank you.